Welcome back. This section of the show is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, how do I know when to keep my child home from school if she's sick? Asked by Susan Allen of Lexington, Kentucky. And here to help me answer that question is Dr. Ashley Rollins, who is our newest Med-Peds physician at Family Practice Associates. Welcome.
Thank you so much.
All right. Now, I said Med-Peds. You finished at the University of Kentucky here in Lexington, and you take people cradle to the grave.
I do.
So if you have, somebody asks you about a sick child and should they go to school, how do you know?
Well, there are a couple of things that we like to look for when thinking about whether or not your child should go to school. Particularly, are they going to be contagious to other children? So one of the big things we look for is a fever greater than 101 Fahrenheit. We also, if your child is coughing, having vomiting or diarrhea, those are kind of some indications that may be time to keep them home from school.
Well, now, school's been in session for a while. Everybody comes from the summertime, they're usually pretty healthy, but they get in the classroom and then they start spreading all kinds of diseases, and we see some pretty common things. Let's talk about some of those. All right, pink eye, tell me about it.
So pink eye is a fairly common condition. There are lots of different causes of pink eye. It can be from allergies, it can be a viral infection or bacterial, and it's sort of difficult to tell the difference unless you go to your primary care doctor. And then it's our job to help you kind of figure it out and decide on the best treatment.
What are some symptoms of pink eye?
An itchy eye, a lot of times watery eyes or crusting on the eyelashes. Sometimes it can be associated with more systemic symptoms, low-grade fevers, cough, runny nose, congestion.
And that's one of those things that I see a lot, that they get sent home from school because they've got pink eye.
Absolutely.
Is it contagious?
Yes, sir, it is. It's pretty contagious. And the way most kids get it is coming into contact with the secretions from that eye, or sometimes nasal secretions as well.
Wash your hands is the big deal.
Absolutely.
All right. The other dreaded thing is lice.
Yes.
All right. Tell me about that.
So lice are really more of a nuisance than a danger. They don't actually carry any diseases that are dangerous for humans, but they're pretty itchy and they can cause a lot of headaches for parents.
And it can happen to anybody. It doesn't mean you're a dirty or a bad parent. It can just occur.
Absolutely. And it's really contagious. So, it can spread through elementary schools like wildfire. And it can be kind of hard to get rid of too. So it's no reflection on anyone that gets lice.
All right, ringworm is another one.
Mm-hmm.
It's really not a worm though, is it?
Correct. It's actually a fungal infection of the skin.
And can you treat that over the counter, or you need to go see your doctor?
You can treat it over the counter. There are some over-the-counter topical antifungal creams that you can use, but if you notice that it's not getting better, it's always a good idea to go see your doctor.
Okay. Ear infections.
This is a common one, especially for young kiddos. Especially for babies, sometimes it's hard for them to tell, that they have an actual pain in their ear, so it's really important to get in to see your pediatrician or primary care doctor so they can take a look.
And I guess you can tell you have an ear infection when you look. When I trained, we treated all ear infections with antibiotics, but maybe not so much anymore?
Yeah, and the recommendations on that have actually changed. They recommend treating younger children with ear infections, or if you have signs of a lot of fluid behind the ear or pus behind the ear and high fevers, then they recommend that we treat.
All right, the other thing, it's flu season. How do you treat it? How do you prevent it?
So the big, an ounce of prevention is worth a pound of cure, and the big way to prevent the flu is to get the flu shot. And everyone get the flu shot, whether you feel like you're normally healthy or not, to help keep it from spreading to people who could really be affected. And the other big thing is washing your hands.
Well, I mentioned washing your hands. Everything we talked about today is if you ought to wash your hands.
Absolutely, yeah. Good hand hygiene is the key to preventing the spread of disease, and teaching that early to your kiddos is really a helpful way to help keep them healthy.
So if you don't get the flu shot, you don't wash your hands, and you end up with the flu, there is some treatment for it.
Yes, absolutely. They found that treatment is actually most effective when it's started within 24 to 48 hours of symptom onset. So if you start to feel like you have the flu, be sure to get in to see your primary care doctor. And it's been shown to shorten symptoms. And usually Tamiflu is the medication that we use.
Sooner the better.
Absolutely.
All right, that's great information. Thanks for coming in.